Health Talk. I'm Julie Banderas. Living longer is something we all want to achieve, but with those extended years also comes added cost. Never thought about that, have you? So how do you navigate adding to your health while making sure you can pay your tab to stick around? Joining me now is Dr. Michael Roizen. He is the Chief Wellness Officer at the Cleveland Clinic and co-author of AgeProof, Living Longer Without Running Out of Money or Breaking a Hip. Well, that's certainly true. We don't want to do either of those. Thank you so much for being here.
Thank you.
First, how do health and wealth go hand in hand?
Well, think about when you're going to die. And whatever age you picked, it's probably too young. We're going to live a lot longer. Wealth without health, you can't have it. And health without wealth, maybe when you're young. But as you get older, you're going to have copays and deductibles and insurance costs. You need them. The great news is that the same behaviors that lead to one lead to the other. And you've got to defeat, if you will, our reptilian brain, and the same way goes for both.
All right, so let's assume we want to live longer, okay? What do we do? I mean, first of all, you've got to prevent chronic illnesses. I mean, chronic illnesses are one of the leading cause of death.
That's exactly right. 84%, in fact, of all costs in America are due to treating chronic disease. So there's 6 choices you can make to get to 6 outcomes. At the Cleveland Clinic, we've done that, and our costs have gone down for our own employees 3 years in a row. And in fact, if America did these 6 habits or 6 choices to get to 6 outcomes, we'd save $200 billion a year from the federal spending on health care. So remember, they're trying to save $100 billion. If 67% of us, about the same numbers, do it at the Cleveland Clinic, it is simple things. It is avoiding toxins. It is being physically active. It is managing stress. It's avoiding the forced snake oil foods. It's not skimping on sleep. And it is getting the right supplements and getting your immunizations up to date. And you get normal blood pressure, normal hemoglobin A1C, normal LDL cholesterol, normal body mass index, if you will, managing stress, and your immunizations up to date. You get those things and you save a huge amount of money for yourself, which you can accumulate in a health savings account or other ways, and you save a huge amount for the country. Okay, so now we've talked about how do we keep our bodies healthy, but there are some inevitable things that happen to our bodies as we age, and that is one thing, your bone density. Obviously it's hard to combat that. Osteoporosis is also obviously very common for older people. Hip fractures is one of the leading causes of putting people in the hospital indefinitely. Well, in fact, it's one of the 2 worries we have. So that's why we say that's in the title of the book. Hip fractures. So the most important thing you can do is jump. Believe it or not. Like on a trampoline? No, not on a hard surface. Okay. Okay, so jumping, just doing jump up and down. So jump like that. Jumping jacks 20 times. Exactly. Jumping rope or just jumping in place. Perfect. 20 times in the morning, 20 times in the evening. It stimulates those cells which add bone mass to do it. Then you want to get the right amount of calcium, leafy green vegetables, get extra vitamin D. Usually you can't do it in diet, so you've got to get it in a supplement. The next thing is learning how to fall. So we're going to fall, and you take a learn how to fall class. That's a great idea. And the 4th thing is you get measured. So you want to get measured with bone density for women at age 50, for men at age 60. Men have a worse time with a hip fracture than women. They don't get it as often, but there's much more chance they won't recover from it. Wow. Okay. And, I've actually read that jumping can release your body of toxins, cancer-causing toxins, in fact. I mean, there's studies out there. I don't know about that. It's true. I can tell you. So I just want my viewers to know as well that, jumping on a trampoline, if you're younger and you're able, is actually incredibly good for you. But do jump on a hard surface as you get older. We don't want you falling off a trampoline. No. So jump on a hard surface, and you can do it with your grandkids if you want by practice jump rope. But in fact, just jumping is a great way of increasing your bone mass. Yes, and it actually does release your body of toxins as well. Right. What about other ways to keep our minds from aging? So there are 8 things that have been shown in randomized controlled trials to make a bigger hippocampus. You have only one organ in the body that matters for size, and that's your hippocampus, your memory center of your brain. Bigger hippocampus, better memory, less cognitive dysfunction. So doing the 4 physical activities, same thing. Avoiding stress. Stress shrinks the brain, so you want to manage stress. The third thing is DHA. The active ingredient in fish oil isn't fish oil per se, it is the DHA. So you want to be called a fathead. 50% of your brain is fat, 60% of that is DHA. It's a actual structural fat in the brain. The fourth thing is avoid the snake oil foods. One game that actually has been shown in randomized controlled trials that increases the size of your hippocampus in your memory and decreases dementia as you get older by 48% is what we call speed of processing games. So you do that in reading and doing other things to go through things, but most people don't get a challenge on their speed of processing. So it's called double decision if you want to go on the internet and get it, but it's the one game shown. Fifth thing is avoid toxins. Sixth is, as I said, stress, but is to get the right supplements and avoid the wrong ones. And last one is don't skimp on sleep. Okay, and tell me about the snake foods again. What are specifically, which ones should we avoid? It is added sugar, added syrups, simple carbohydrates or stripped carbohydrates. Those are things that raise your blood sugar too fast. So like a white pasta. Horrible. Rice, anything white. Yeah, basically. Except for cauliflower
yes, of course. No, but any starchy carb. Right. White food, those starchy, super starchy foods.
Exactly. And then foods with saturated fat. It's not the saturated fat, it's the amino acids with it. Carnitine, lecithin, choline change the bacteria inside you.
You want monounsaturated fats.
Exactly.
Like avocado and such.
Right. Omega-9, olive oil, and omega-3, which is the fish oils, but also avocado and walnuts.
Okay. All right, and how can we get more information?
You can get it at ageproof.life. It's not a .com, it's a .life. So ageproof.life, or of course, it's all in the book.
AgeProof. You have to read this book and learn how to live longer and save money, and you need both in order to do so. Thank you so much, Doctor. Thank you. It's great to meet you. And if you have a health question, send a tweet to Fox News Health. Thanks for watching. I'm Julie Banderas.